भवतु सहनौ भुनक्तु सह वीर्यं करवावहै तेजस्विनावधीतमस्तु मा विद्विषावहै। ॐ शान्ति शान्ति शान्ति। Rub your palm, place it on your eye and relax. Namaste everyone.
You can start your camera.
So are you telling something? I mean, not able to hear you. No, sir, not able to hear you.
Hello, now am I audible?
Yes, sir.
Yeah. Later. Pearl logged out thinking that she has some problem. So now let her log in. We'll start. Yeah, Rupal, start now.
Okay. Sir, initially I'll keep camera off because I'm not sure. I'm dependent on mobile data. Today there's so much of fluctuation. So I'll try to switch on. Okay. Give me some time. All right. There's so much of adrenal rush. I don't know.
So what I would suggest is जब तक आपका PPT start नहीं कर रहे हो तब तक आप अपना कैमरा चालू रखो. जब से PPT start करोगे then you can keep your cameras off.
Sir, I'll share only. I'll share my screen now only.
Then start.
Okay. So is the screen visible? Can
Yes.
anyone of you tell me?
Yes, dear.
Just a second. All right. All right. So basically, good afternoon, everybody. Let me know. All right. I mean, if I lost connection, if you can't hear me, please let me know. Okay. So basically, today I will try to explain about yoga therapy for menstrual disorders and PCOS. All right. Okay, so I'll begin. So before we understand that what are the menstrual disorders and what is PCOS, I think first we should understand that what is female reproductive system. I think basically we all know, right? But still I will try to explain. So the female reproductive system is made up of the internal and external sex organs, right? So basically I can say that it is divided into two parts, internal and external organs. So there are many functions, but the main function of female reproductive system is to reproduce a new offspring. All right. So in human, the female reproductive system is immature at birth and develop to maturity at puberty to produce gamete and to carry a fetus to full term. So puberty is a time when gonals develop both endocrine and gametogenic functions. So basically, it is trying to say that, at the time of birth, the system is not mature. So at the time of puberty, reproduction, I mean, reproductive year starts, right? Basically, it starts, I would say, somewhere from 13 to 15 years. Now let's see what is internal reproductive organs. So this also I think we know very well. So it is divided into uterus, then ovaries, fallopian tube, vagina, and cervix, right? So womb, this middle area is we can call it womb, and this pipe-like structure is a fallopian tube, and these are the ovaries. Okay, this like ball-like structure. So the main function of ovaries is to produce ओवम और एग्स एंड fallopian ट्यूब. ठीक है. फिर जब वो आगे आती है तब उसका इम्प्लांटेशन होता है यूट्रस में. एंड दिस इज द वजाइना. ओके. So vagina, you can say the birth canal also, क्योंकि baby वहां से आता है, right? जब भी at the time of birth. And the cervix, you can say the head or neck of the uterus, right? So this is the internal reproductive system. Now external reproductive system. So basically, external is something which can be seen from outside. We know that. Okay. So the first is labia majora. So the very outer structure, which is lip-like structure, we can call it labia majora. Okay. And yes, it is made up of skin, fat, tissues, right? So that is labia majora. उसके अंदर का जो structure होता है same lip-like structure, that is labia minora. Okay. And then this pubic, we know it very well, right? Like one of the bones of pelvic. And then this is the clitoris, the most sensitive parts of female reproductive organs. And then this is vestibule. This is, you can say, the age of labia minora, or labia minora के अंदर का part है age of that is vestibule. This is anus. And then clitoral hood. So I would say this is the, जो आगे से दिखता है, where is like where the labia minora joins, that part is called clitoral hood. And then yes, this posterior commissure is labia majora, जहाँ पे मिलता है posteriorly, that is called posterior commissure. So this is all about female reproductive system. Now, as we are going to learn about the menstrual disorders, first let's understand what is menstruation. Again, this also we know very well, okay, that what is menstruation, but still let me explain. So menstruation, we call it periods also, right, is a regular discharge of blood and mucous tissues from the inner linings of the uterus through the cervix and vagina. So normally this discharge happens after every 28 to 30 days. That is why it is called the menstrual cycle. So this cycle goes on throughout the reproductive period of female life, except during pregnancy, in certain disorders, some hormonal imbalance, right? And the first period usually begins between 12 and 15 years of age in girls, a point in time known as menarche. So when this cycle completely and permanently stops, that time is called menopause. And this generally occurs around 45 to 55 years of female age, all right? So the menstrual cycle occurs due to the rise and fall of hormones. This cycle results in the thickening of the lining of the uterus, causing contraction in the uterus and urinary tract. So this cycle causes menstruation in both men and women.
Rupal ji, you're not audible.
Hello. Can you hear me, guys, now?
Yes, yes, we can.
As I told you, it's very bad network today. Okay, just a second. Again, I'll have to share my screen. Okay. Where we were. Okay. All right. So yes, I was telling that हर महीने वो एक thick lining create होती है in the uterus, assuming कि pregnancy होगी, right? अगर pregnancy नहीं होगी तो वो shed out हो जाता in the form of periods, right? So that is what menstruation is. This is what our period is. Now let's see what are the menstrual disorders. So the first menstrual disorder is dysmenorrhea, which is painful cramps. So, dysmenorrhea is severe, frequent cramping during menstruation. Pain occurs in the lower abdomen but can spread to the lower back and thighs. So, dysmenorrhea is usually referred to as primary and secondary, right? So, basically, what is dysmenorrhea? So, dysmenorrhea is, sometimes we feel very bad cramps and sometimes abdominal pain. So that is called dysmenorrhea. And again, it is divided into two parts. So which is primary dysmenorrhea and secondary dysmenorrhea. So what is primary dysmenorrhea? So it's cramping pain caused by menstruation. So the cramps occur from contraction in the uterus and are usually more severe during heavy bleeding. All right. Now, what is secondary dysmenorrhea? So, menstruation related pain that accomplish another medical or physical conditions such as endometriosis or uterus fibroids. Okay, so अभी आपको ये जो pain है आगे की condition में lead करता है, which is endometriosis and uterus fibroids. So, what is endometriosis? So, little bit I would say कि ये जो thick lining होती है ना, basically it's there in the एंडोमेट्रियम राइट विच इज इन यूट्रस. तो आपको वो लाइनिंग्स यूट्रस के बाहर भी देखने के लिए मिलती है, दैट इज एंड्रोमाइटोसिस. एंड देन दिस यूट्रस फाइब्रोइड्स अगेन दैट इज लाइक नॉन कैंसरियस ट्यूमर्स दैट इज हैपनिंग इन द यूट्रस. तो वो आगे लीड जब इस कंडीशन में करती है, सो दैट इज secondary dysmenorrhea. Now, what are the causes for the dysmenorrhea? So, primary dysmenorrhea is caused by the prostaglandins, which is hormone like a substance that are produced in the uterus and cause the uterine muscle to contract. So ये जो prostaglandinites नाम का एक स्ट्रक्चर है वो जो प्रोड्यूस होता है तब वो आपके यूट्रस को कॉन्ट्रैक्ट करता है, बिकॉज ऑफ दैट दिस पेन इज हैपनिंग. ऑलराइट. And then secondary dysmenorrhea can be caused by a number of medical conditions. Common causes for secondary dysmenorrhea, as I said earlier, endometriosis and uterus fibroids. Other causes can be some pelvic inflammatory disease, or maybe ovarian cyst, or maybe ectopic pregnancy, right? So this can be the also reasons for dysmenorrhea. So that was about dysmenorrhea. Now, what is menorrhea? Menorrhea is something heavy bleeding. So menorrhea is the medical term for significantly heavier period. Menorrhea can be caused by number of factors during a normal menstruation. The average woman loses about 30 ml of blood and changes her sanitary products around 3 to 5 times per day. Okay, it's like approx number. It doesn't apply to everybody. All right. Now, what happens in menorrhea? So, in menorrhea, the menstrual flow lasts longer and is heavier than normal. So, this bleeding occur at regular intervals, yes, but may last for somewhere 7 or more than 7 days, and menstrual flow soaks more than 5 sanitary products per day or require product change during the night as well. All right. And sometimes clot formation is also happening in menorrhea. Now again, menorrhea के भी type है, तो उसमें first है metrorrhagia, also called breakthrough bleeding, refers to bleeding that occurs at the irregular intervals and with variable amounts. So you know what is happening here? Heavy bleeding is there, but it is happening at the infrequent time, so that is called metrorrhagia. Now, manometrorrhagia, what is that? So refers to heavy and prolonged bleeding that occurs at irregular intervals. So metrorrhagia combines features of both menorrhea and metrorrhagia, both. Okay, bleeding is heavy at the same time infrequent, so both symptoms can be seen in manometrorrhagia. Then other dysfunction, uterine bleeding. So a general term for abdominal uterine bleeding that usually refers to extra or excess bleeding caused by hormonal problems, usually lack of ovulation. Then this DOB tends to occur either when girls begin to menstruate and when women approach menopause. Okay, so this is one type of menorrhea. ये तब होता है जब आपके पीरियड्स का इनिशियल स्टेज होता है या तो फिर आपका मेनोपॉज स्टेज होता है. ठीक है, तब जब आपका ब्लीडिंग हैवियर है तो दैट इज कॉल्ड dysfunction uterine bleeding. All right, so other type of abnormal uterine bleeding, you can say that bleeding after sex, and maybe bleeding after menopause also. Postmenopausal bleeding is not normal and can be sign of yeah, we know that. So दूसरे कौन से I mean टाइप से, तो सेक्स के बाद पेन होना या तो फिर मेनोपॉज टाइम खत्म हो जाता है तब भी ब्लीडिंग होना. ओके, सो दिस आर ऑल टाइप्स ऑफ menorrhea. Okay, so menorrhea, what are the causes for menorrhea? So sometimes hormonal imbalances, sometimes ovulation problems, or maybe uterine fibroids, or uterine polyps and endometriosis. So these are the causes for the menorrhea. You know what do I feel while doing this study? Everything is interconnected. Okay, and kahin na kahin almost the reasons, signs, symptoms, causes are almost I find very similar. So the medications like contraceptives, then bleeding disorders, sometimes cancer, sometimes infection of the uterus and cervix, pregnancy or miscarriage, other medical conditions like diabetes, pelvic inflammatory disorders, then thyroid. There are so many reasons, okay, for that. So that was dysmenorrhea, then menorrhea, now amenorrhea. Okay, the absence of menstruation. So the amenorrhea is the absence of menstruation. So there are two categories of that. So here also, like dysmenorrhea, primary and secondary. So what is primary? So occurs when a girl does not begin to menstruate by age 16. So girls who show no signs of sexual development, like breast development and pubic hair by age 13, should be evaluated by a doctor, and any girl who does not have her period by age 15 should be evaluated for primary amenorrhea. Okay, now what is secondary? So occurs when periods that were previously regular stops for the at least 3 months. Okay, so this is primary and secondary amenorrhea. Now oligomenorrhea, which is infrequent menstruation, and hypomenorrhea, which is light menstruation. All right. So oligomenorrhea is a condition in which menstrual cycles are infrequent, occurring more than 35 days. And it is very common in early adolescence and does not usually indicate medical problems. Light or scanty flow is also common in the first years after menarche and before. So yeah, so basically, oligomenorrhea is a very infrequent, time duration बढ़ जाता है, ठीक है, oligomenorrhea में. And what is light? So here you will get very, spot like periods. बहुत ज्यादा आपका flow नहीं है, सिर्फ spots आते हैं. So that is light menstruation or hypomenorrhea. All right, now the what can be the causes for amenorrhea and oligomenorrhea? So again, delayed puberty, hormonal changes and puberty, so weight loss and eating disorders, sometimes heavy athletic trainings, stress, PCOS can be also the reason for it. Then um, elevated levels of hyperprolesterolemia, then prolactin. So this is something, prolactin hormone, right? Prolactin hormone produced in the puberty. So इसमें भी कहीं पे imbalance hai. So there can be a reason for dysmenorrhea, uh, hypomenorrhea, and then premature ovulation failure, structural problems. So sometimes there may be a, some of the other way structural problem that can be also the reason. And some other conditions, some other medical conditions like epilepsy, thyroid, metabolic syndrome, and Cushing disease. So yes, so that's it. Now some more, like last disease, I think, premenstrual syndrome. I think this is felt by everyone, I feel. Okay, personally, कहीं ना कहीं जब भी आपका periods होने वाला है ना, तो before a week, physically, mentally, emotionally, uh, we have certain changes. So that is premenstrual syndrome. So is a set of physical, emotional and behavioral system that occurs, typically do not start, okay, it start before a week, as I said. So the symptoms typically do not start until at least day 13 in the cycle and resolve within a 4 days after bleeding. Okay, वो बाद में settle हो जाते हैं ये symptoms. So we all know, right? As I said, कहीं ना कहीं सबको ये feel होता है. So it usually occurs when they are in their late 20s to early 40s, right? So ये symptoms जब आपके 20s से 40s के बीच में कहीं ना कहीं देखने को मिलते हैं, then once established, so the symptoms tend to remain fairly constant until menopause. So it is said कि एक बार अगर symptoms develop होना शुरू हो गए तो कहीं ना कहीं menopause तक देखने के लिए मिलते हैं. Okay, now before we go for yoga therapy for all these diseases, I think we should understand, see, these are the medical terms. बहुत मुझे समझ नहीं आती. Okay, I'll be very frank, but what kind of medications can be given to treat this kind of disorders? So basically, first they have mentioned that common pain relievers for cramps. ठीक है, so they are telling that okay, अगर आपको cramps है, heavy pain है, so you can go for painkillers. Then they have mentioned many names for the medications, like Advil and Motrine, Midol, PMS. So these are the all what I would say, pain relievers, okay, painkillers, you can say. Then contraceptives also given sometimes in heavy menstruation. Then I was asking to sir, right, this progestines. So this progestines, these are also like, artificially, I read, then I understood. I don't know, I'm not sure about. So progesterones को जब आप artificially insert करते हो, I think that they call it progestines. तो here also progestines insert किए जाते हैं in diseases like menorrhea, heavy bleeding है तब. So ये oral form में भी दिए जाते हैं. Sometimes IUD, right, nowadays this is very common but it is very painful. What is IUD? So ये एक डिवाइस होता है जो आपके यूट्रस के अंदर इंसर्ट किया जाता है. तो जब जब प्रोजेस्टाइन की जरूरत है वो रिलीज करता है, राइट. सो दैट इज IUD. And intrauterine device, okay, so this is IUD. So जब भी कुछ आपके medication कुछ काम नहीं करता है तो sometimes doctor suggest के you will have to go for this IUD. as I said कि ये एक device होता है जो आपकी uterus के अंदर insert किया जाता है. And what is next? that injection के form में भी प्रोजेस्टाइन दिए जाते हैं, ठीक है. So this is that. And what is GnRH agonist? So gonadotropin releasing hormones block the release of the reproductive hormones, which are LH. And I think this is also a medication for heavy menstruation, जो आपको LH और FSH को कहीं ना कहीं थोड़े block करते हैं. So उसकी वजह से आपका menstruation थोड़ा light हो जाता है. Okay, I mean okay. Next is danazol. So what is danazol? Is a synthetic substance that resembles a male hormones. It suppresses estrogen and therefore menstruations and occasionally used. Okay, so this is also something, I think I feel these are the all बाहर से आपके medication दिए जाते हैं which maintains your hormones कहीं ना कहीं, and that will help you to treat this kind of menstrual disorders. It may be light bleeding, it may be menorrhea, it may be hypomenorrhea. कहीं ना कहीं फिर non-hormonal drugs. So what are this? So again they have given some name like Listeda is a newer medication for treating heavy menstrual bleeding and the first non-hormonal drug for menorrhea treatment. So tranexamic acid is given as a pill. As I said, these are the all terminologies, okay, I think names of the medicine. So it is an anti-fibrinolytic drug that helps blood to clot, and the FDA warns that use of this medication by women who take hormonal contraceptives may increase the risk of blood clot. Okay, as I said, these are the terms and things जो मुझे बहुत ज़्यादा समझ नहीं आती है, but these are the medical terms and these are the given to treat this kind of menstrual disorders. And yes, last option we can say surgery, right? अगर कुछ भी नहीं बचता है तो of course we'll have to go for the surgery. So in surgery there is a endometrial ablation, two types of surgeries, all right. And this is hysterectomy, right? And what is what is endometrium ablation? So in endometrium ablation, so the entire lining of uterus, which is endometrium, is removed or destroyed for most women, and this procedure stop the monthly menstrual flow. In some women menstrual flow is not stopped but is significantly reduced. Okay, so this is one surgery. And here hysterectomy, it is something where there is a removal of uterus, all right. So last option would be a surgery. What can be the other system of healing for this kind of menstrual disorders? So yes, we know diet also plays important role. So dietary adjustments like whenever you go to expert सो आई हैव हर्ड कि ना आपके जब भी पूरा एक महीने का फेज होता है ना आपके पीरियड्स का, तो उसमें दे कीप चेंजिंग डाइंग, ओके, योर डाइट की फर्स्ट वीक ये लेना है, सेकेंड वीक, थर्ड वीक एंड व्हाट्स एट द लास्ट वीक. सो द डाइट प्लान्स कैन हेल्प यू, यू कैन go to an expert, they can help you out. And the general what you should focus on, so keep yourself hydrated, eating plenty of whole grains, fresh fruits, vegetables, and avoiding saturated fats and commercial junk food. See, we all know it very well, all right, that the most common reason I would say junk food खाना बहुत major reason पाया गया है in this kind of menstrual disorders, right? So you can avoid junk food, you can keep yourself hydrated, you can have more fibers and yes, more vegetables and fruits. So yes, and again you can go to an expert. Yes, what can be the other lifestyle measures you can apply? So yes, exercise भी बहुत important role play करता है. Applying heat, तो अगर आपको cramps है या तो फिर पेन है, you can apply heat. And of course very important, menstrual hygiene भी maintain करना उतना ही important है, right? उस एरिया को proper wash करना, टाइम टाइम पे sanitary आपके जो पैड्स है उसको चेंज करना, राइट? सो ये भी एक क्योंकि इससे भी बहुत इन्फेक्शन होने के चांसेस है. सो यू कैन मेंटेन menstrual hygiene. And then yes, in Ayurveda you can go for panchkarma therapy also, that is also very much beneficial. So this is about menstrual disorders. Okay, I know you must be feeling boring, okay guys, but please bear with me some more time. Okay, so now PCOS. So this is also like you can say this is also menstrual disorders, but PCOS will see it separately. So polycystic ovary syndrome is a hormonal imbalance that occurs when your ovaries, okay, we know what is every ovaries, right? That produces eggs and create excess hormones. If you have PCOS, your ovaries produce unusual high levels of hormones called androgens, and this causes your reproductive hormones to become imbalanced. As a result, people with PCOS often have irregular menstrual cycles, missed periods, and unpredictable ovulation, small follicle cyst, which is, that's why it is called polycystic ovary syndrome. So because उसमें cyst होते हैं आपके ovaries में, which is fluid filled sacs जो पाए जाते हैं आपके ovaries में, may be visible on your ovaries, yes, understood, due to lack of ovulation. And however, despite the name polycyst, you don't need to have cyst on your ovaries to have PCOS. The ovarian cysts aren't dangerous or painful. Yes, this is the condition जिसमें basically the basic symptom I would say कि आपके ovaries में cyst पाए जाते हैं, but जरूरी नहीं है कि वो cyst होने ही चाहिए. Even though there is no cyst, a female can be diagnosed with PCOS. All right. So how it is looking? So see, this left side you can say this is the cyst, ovaries with cyst. जब भी आपको PCOS है तो आपकी ovaries ऐसे दिखती है, and these are the normal ovaries. Okay, so जब भी आपके fluid sacs होते हैं ऐसे cyst, so this is called polycystic ovarian syndrome, which is PCOS. Okay, so what are the signs of PCOS? So the most common signs and symptoms of PCOS are, so yes, we all know irregular periods, then abnormal hair growth. Are you guys there?
Yes, yes.
I thought I lost my connection. But I can see you. Just a second. Okay. So yes, the common symptoms. So the first I said that irregular periods, Then second would be abnormal hair growth on the like male like a hair growth, okay, आपके body के ऊपर, आपके face के ऊपर. So that I think we learn in one of the sessions that is called hirsutism. I don't know exactly, but I think ये हमने पढ़ा था in one of the art therapy sessions. Then acne, yes. Then obesity इसलिए बढ़ जाता है I think क्योंकि आपका BMR भी बहुत low हो जाता है, okay, in PCOS. Then darkening of the skin, then yes, as I discussed, cyst, then skin tags, thinning of the hair, infertility. Okay, so these are the common signs and symptoms. And what can be the major cause for PCOS? So higher levels of male hormones called androgens. So yes, that's the major reason. What's the other cause? So insulin resistance, अगर आपका body insulin resistance हो जाता है, that can also lead to PCOS. Then low grade inflammation, and yes, this can be the causes for PCOS. Now medication PCOS में क्या दिए जा सकते हैं? तो hormonal birth control या then contraceptives you can say, then insulin resistance medicines, then medication to block androgens, and drugs to I think this is उस कंडीशन में जब आपको प्रेगनेंसी करनी है, तब ओवुलेशन ऑटोमेटिकली नहीं होता है, तो आपको ड्रग्स दिए जाते हैं, आई मीन मेडिकेशन, सो दैट आपका ओवुलेशन प्रॉपरली हो जब भी आपको कंसीव करना है. ओके, देन सर्जरी can also help. And yes, again it is in such condition जब भी आपको PCOS है and आपको conceive करना है, so IVF also can be one of the option. Now again for PCOS, let's see how we can cure PCOS. So yes, lifestyle modification for PCOS, we know balanced diet. सो अगेन आई थिंक जितना मुझे पता है कि पीसीओएस में आपको मोस्टली डेयरी प्रोडक्ट्स अवॉइड करने के लिए बोला जाता है, एंड कार्ब्स भी थोड़े कम लेने के लिए बोला जाता है. सो व्हाट यू कैन फोकस ऑन मोर फाइबर रिच फूड्स, गुड वेजिटेबल्स एंड फ्रूट्स. अगेन फ्रूट्स भी कुछ भी अवॉइड करने होते हैं उसमें, आई एम नॉट श्योर एग्जैक्टली, बट यस फ्रूट्स लाइक पाइनएप्पल एंड ऑल, राइट. एंड व्हाट यू कैन इंक्लूड इज cinnamon tea, green tea, then soaked nuts. So this kind of food will help you for PCOS. Then yes, of course, the very major reason is your stress. So you can learn to maintain your stress level. Going for a walk in nature, yes, you can enjoy the fresh air. Then getting into habit of meditation daily. Then weight management, panchkarma therapy here also. All right, now at the last, we'll see that what is the yoga therapy we can give. Okay, so now we all know, I think Kalyani also explained that day, if we talk about human existence, so usually we divide it in 5 layers, right? So very outer layer we call it annamay kosha, then uske andar ka pranmay kosha. See, annamay kosha sabse bahar ka, then pranmay uske bahar ka, manomay, vignanmay, and anandmay kosha, right? सो कुछ भी चीज के लिए कोई एक रीजन कभी नहीं हो सकता है, एंड स्पेशली फॉर दिस काइंड ऑफ साइकोसोमेटिक डिसऑर्डर्स. सो यूजुअली वी लर्न इन एस व्यासा के जो भी ये साइकोसोमेटिक डिसऑर्डर्स होते हैं ना, तो इट स्टार्ट्स विथ योर माइंड. ओके, ये डायरेक्टली फिजिकली नहीं आ जाता है. तो फर्स्ट इट कम्स टू योर माइंड, देन इट रीचेस टू योर प्राणा, एंड देन इट रीचेस टू योर बॉडी. तो वैसे वो आता है. So if you want to treat any psychosomatic disorders, now you need to work on all 5 layers of human existence, right? तो योगा में भी हमको पता है कि मेडिटेशन है, फूड का भी मेंशन है, राइट, लाइक मीताहार एंड डाइट. सो यस, ऑफ कोर्स, जब भी योगा की बात करते हैं तो सारे लेयर्स के ऊपर काम करना है, राइट. सो फर्स्ट लेट्स सी अन्नमयी कोशा. सो आप शिथिलीकरण व्यायाम, स्थूल व्यायाम, सूक्ष्म व्यायाम दे सकते हो. देन बैकवर्ड फॉरवर्ड बैंडिंग, साइड बैंडिंग, ट्विस्टिंग वुड बी रियली गुड, बटरफ्लाई फ्लैपिंग वुड बी रियली गुड, एंड asanas like paschimottanasana, janushirasan, then marichyasan, baddhakonasan, malasan, then bharadwajasan, vakrasan, gaumukhasan. Almost जितने भी आसन्स है, I would say it's good for PCOS, क्योंकि it's always about, I feel, okay, yoga is always holistic approach. हाँ, we need to take care of few contradiction, but एक आसन करते हैं तो जरूरी नहीं है कि वो सिर्फ एक ही डिजीज के लिए काम करता है. जैसे भुजंगासन की बात कर ले तो इट मे बी गुड फॉर पीसीओएस, इट मे बी गुड फॉर थायराइड, इट मे बी गुड फॉर बैक पेन, राइट? सो इट्स ऑलवेज होलिस्टिक अप्रोच, हाँ, कॉन्ट्राडिक्शंस को ध्यान में रखते हुए. So yes, Padmasan, Siddhasan, Vipreet Karni with Ashwini Mudra, then Sarvangasan, Pavan Muktasan, Setu Bandhasan, cycling you can do, leg raising, then Supta Vajrasan, Naukasan, Bhujangasan, Dhanurasan, Shalabhasan, Warrior series, right? Warrior 1, 2, 3, then Parshva Konasan, Utthit Padangusthanasan, Garudasan. Then again, this is a technique, cycling meditation. It is this technique also we have learned in SVS. Okay, this is really good technique. And I forgot to mention one thing, आप मूल बंद की भी प्रैक्टिस कर सकते हो. ठीक है, पीरियड्स है तब नहीं करके, yes, in regular days you can do the practice of मूल बंद also in all the menstrual disorders. And then if we talk about pranamay kosha, that is what we can do, that kapalbhati, sectional breathing, alternate nostril breathing, ujjayi pranayam, bhramri pranayam, again pran energizing, pranic energizing technique. This is also technique is mentioned, I have learned in SVS, I would say. Then if we talk about मनोमय कोशा, आपके mental level के ऊपर क्या काम करता है, तो नाद अनुसंधान. Then yes, of course, meditation again. These are the also techniques, MSRT, mind sound resonance technique, mind imaginary technique, mastering the emotion technique. So these are the all techniques we have learned in SVS. Again, Vignanmay Kosha, yes, of course, the best therapy, I would say, you can go for counseling, you can go for satsang. This Vishak also a technique which was mentioned in SVS. I think I learned in SVS only. So and at the end, if we talk about Anandmay Kosha, then being in silence, you can go for the silence practice sometimes in a day. Then always being in awareness, you can be mindful. Then yes, karma yoga. So these are the practices. If we talk about yoga therapy, can be good for these diseases. And a paper I would like to share, कि योगा कैसे हेल्प करेगा आपको, इन द PCOS, आई वुड से. तो ऐसे बहुत सारे रिसर्चेस होते हैं, तो उसमें लेट मी सी what was the objective of this study. So the objective of this study was to study the effect of structured yoga intervention on anthropometric metabolic, then biochemical, ovarian, morphology, and infertility related quality of life parameters among infertile women with PCOS. ठीक है, तो ये स्टडी हुआ था जो PCOS वाली फीमेल है इनके ऊपर. ठीक है, तो अभी क्या methodology क्या था, तो infertile women with PCOS, 26 participants in each group, which include intervention and control. See, whenever you do this kind of research, there are mostly two groups. Okay, yes, there are different types of research. So in this research there were two groups. ठीक है, एक तो interventional group था जिसके ऊपर ये सारी practices apply हुई थी, and other was control group जिसके ऊपर ये सारी practices नहीं हुई थी. दोनों को रखा गया था under observation, giving these practices for 3 months. Okay, yoga intervention दिया गया था for the 3 months. So now we'll see the results. So there was a significant difference in the weight, BMR, and post-glucose insulin, then AMH, cholesterol, then HDL, LDL, then GPT, ultrasound parameters such as stromal thickness, follicle numbers of ovary, and quality of life in infertility domain in the intervention group compared to the control group. Within 1 year of initiation of this study, 13 participants became pregnant in yoga intervention group as compared to 7 participants in the control group, right? So we can see the results. जिसको yoga intervention दिया गया था, उनमें से there were 13 females who got pregnant and control group 7 female. So I think शायद उनको कुछ नहीं दिया होगा या तो फिर इनको कुछ और मेडिकेशन दिया गया होगा. So not sure exactly, but yes, we can see the results of yoga intervention, right, on the problems like PCOS. So yeah, that's it. Thank you so much, everybody, and thank you for bearing. Thank you so much. Sir is not there, kya?
They're open for questions now. Yes, let us. Everybody has to ask one question.
Sir, don't scare me.
सर पीरियड्स में वो बंद लगा सकते हैं, मूल बंद?
Yeah,
Yes.
Rupal, ask it.
हाँ, कल्याणी, I said जो periods है तब नहीं लगाइए बंद,
Okay.
but
Okay.
when you are doing your yoga practice.
आपका आवाज नहीं आ रहा रुपल जी, आपका आवाज नहीं आ रहा.
Okay. तो पहला है कि the presentation was very nice. Okay. Am I audible right now? Yeah. Okay. Secondly, आपने इसके अंदर हार्मोनल रिप्लेसमेंट थेरेपी को भी थोड़ा इंक्लूड करना चाहिए. हाँ, रूपल, am I audible?